Welcome to the ATACH II simulated enrollment video. This video illustrates the practical challenges involved in recruiting an ATACH II patient and demonstrates some best practices that we would encourage our clinical sites to adopt. This is a 53-year-old man found by his brother on the living room floor at 2:30. He cannot move his right side or speak. However, he does respond to commands. His BP is 195/110, and his brother is on the way to the emergency department.
This patient has ICH, Eric.
Would you like me to notify neurosurgery?
Yes, please do. When we go up there, we should call them. He's not a surgery candidate right now, but I think they still should know about him.
Okay.
Well, he's a potential ATACH II candidate, so let me call Kathleen, the study coordinator, and let her know. Hey, Kathleen. This is Dr. Hussein. We have an ATACH II candidate in the ED. We're actually down in the CT scanner right now. This is a 53-year-old man. He was found down by his brother about 2 hours ago. He's a bit sleepy, NIH stroke scale of 10. His blood pressure is consistently above 190. We still need to verify the time of onset. The brother is on the way, but I think he's a potential candidate.
Thanks for the call. Do you have the patient's name and medical record number?
Yeah, sure.
I'll need that so I can call pharmacy to give them kind of a heads up of a possible enrollment before I head over to the ED. And the other thing too is we've got a study notebook in the ED. If you can start looking at the inclusion-exclusion criteria for eligibility and randomization, and there's also a consent form, so you'll be ready when the family arrives if they get there before I do. The other thing too, you might want to ask the ED nurses to start preparing nicardipine, just in case you think that you'd like to use that for blood pressure management. I know it's the standard, and be just helpful if we get a tight enrollment time as well.
Yes, that's a good idea. Well, Eric, if you don't mind, can you start the nicardipine infusion from the ED stock?
Yeah.
Aim for blood pressure of 160.
I can do that.
Okay, Kathleen, we're waiting for you, okay?
Okay, thanks.
Bye. Bye.
The hematoma volume is measured using the ABC/2 method. Find the slice where the ICH has its largest area. Measure the longest axis from tip to tip in centimeters. Then find the measurement of the axis perpendicular to the long axis at its greatest length in centimeters. Remembering, the axes do not necessarily bisect one another. These are your A and B measurements, respectively. To find the C measurement, count the number of slices in which the hematoma is visible and multiply by the slice thickness. Multiply A times B times C and divide the product by 2. The result is a hematoma volume.
Dr. Hussein, I just talked to the brother, and he said he was normal at 2 o'clock, and then at 2:30 he found him down in the living room, and that's when he called EMS, and then they brought him in. The brother is his next of kin, and he seems like he might be willing to give consent to the study.
Okay, the blood pressure is still high above 190. Let's start nicardipine now, and hopefully the brother will be here in time. The time window is closing. Let's aim for a systolic of 160 for now.
Okay, I'll talk with the nursing staff so they know.
Okay.
We're ready to start the nicardipine.
So Eric, for this study, it's really important that we maintain a blood pressure 140 or greater until we randomize the patient, until we know which treatment group. Meanwhile, when you monitor him, if you can let us know of any changes, but we'll be getting the consent and double checking the inclusion and exclusion criteria, and then we'll get the randomization assignment. So let us know if there's any changes, and we'll be right here in the ED.
To randomize a subject into ATAC 2, log into WebDCU at dcu.edu/ATACH2. Click the blue Login button to proceed. Enter the email address you registered with WebDCU, along with your password to log in. To randomize a subject, simply go to Add New Subject box on the main menu screen. Enter the date of the enrollment randomization visit, and then click on Add Subject. A warning box will pop up that asks you to confirm that you want to enroll and randomize a subject. Clicking OK will add a subject to the study database, so do not click OK unless you really intend to enroll and randomize a subject. Complete the eligibility form and click Submit to receive your treatment assignment.
Dr. Hussein, thank you for getting the consent.
Yes, sure.
I've already randomized the patient. He's been assigned to the standard treatment study group. So I'll just talk to the nurses so that they know, and we'll kind of get them, get the titration started.
Okay. Eric.
Here is kind of our cheat sheet, if you will, for helping guide you through all the changes we need to make, all based on blood pressures. We're trying to stay in this target zone, and every 15 minutes you may need to make a change.
Okay.
But if you can document that, plus blood pressures, we'll stay here if you've got any questions at all, and then we'll also accompany the patient up to the ICU.
Okay.
Thank you, Eric.
Yeah.
Hi, Kathy. I'm from the ATAC 2 study. I'm the coordinator. The patient that you have now was enrolled in the ATAC 2 study. So it's the antihypertensive treatment of an intracranial hemorrhage, or intracerebral hemorrhage.
A little bit about that. Okay.
Yeah, this is the patient that we're enrolling. And what I need from you is your help in helping us follow the protocol.
Okay.
So we're using nicardipine to maintain a really precise range of blood pressures. Ideally for this patient, we'd want to keep it around 160. That's really be our target, not precisely, but the best you can, by titrating it every 15 minutes as you need it.
Okay. Okay. I see the range here, 140 to 180. Okay. All right. And we're titrating by mgs per hour, and that actually looks very standard. So.
Good. We'll just need to, again, keep track of the blood pressures. That'll be important for us in documentation as well. And I'm here for any questions that you've got about the study. I know you're busy trying to get the patient settled.
Well, you know, as soon as I do get him settled, I would love to hear more about the study. So can I meet with you in just a minute?
Absolutely.
Okay. Great.
Thanks.
Thank you. Okay, he's all settled. I just turned that up to 12.5 a little bit ago, and he's right at 158 over 95 now. So I think we're stable for a few minutes.
Great.
So let's talk about this a little more.
Great. Well, this is, again, the ATAC 2 study. It's a NIH-funded study for us to look and compare how we manage blood pressure patients with intracerebral hemorrhage. So this patient's in the standard treatment group. This is pretty much following what our standard of care is here. But one of the things that we're really concerned with is watching the blood pressure and titrating the nicardipine appropriately. So I see that you're at 12.5. 15 is our maximum, and what I really want you to stress is that if we reach the maximum dose and that patient's blood pressure is still rising outside of that range, we need to call the stroke team or the study investigators so that we can manage that blood pressure, because then they may choose to take some other measures.
Okay, all right, sounds good. And then, all these monitors are programmed. So it's all set to keep track of everything for you. And so you need pretty good data. And we can actually print that out for you tomorrow.
That will be really, really helpful, because I know it's the only way we can really capture blood pressure for the first 24 hours.
Yeah, it goes automatically to the record, but sometimes it misses a few things or something, but it is stored for 24 to 48 hours.
Well, that'll be really helpful
print everything, so.
for the monitor visit especially.
Yeah.
So again, we're available 24/7. If you need to call us, please do, and pass that out on the next shift, and we'll be trying to monitor as well.
Okay, that sounds great. Thank you.
Thank you.
Oh, Dr. Hussein, good you're here. I was just going to call you. His blood pressure just dropped down to 100. So I turned off the nicardipine.
Okay, good job.
And I want to let you know right away.
All right. Did his exam change?
No, neurologically he's stable.
Okay, all right, that's good. Well, let's give him a bolus of normal saline
Okay.
and re-examine him again in 30 minutes. You can give him 500 cc's. And we want to make sure that we watch out for any change in the neurological status.
Okay, we're monitoring very closely.
All right.
And I will call you then in 30 minutes?
Okay, yes.
Sounds great. Thank
Thank
you.
you. Thank you.
An adverse event is defined as any event or complication that was not previously identified, or that occurs with greater frequency or severity than previously reported. The investigator, on the basis of his or her clinical judgment, determines the relationship of the adverse event to the protocol intervention as one of the following: unrelated, unlikely, possibly, probably, definitely. An adverse event becomes a serious adverse event when one of the following outcomes occur: death due to any cause, a life-threatening adverse experience, inpatient hospitalization or prolongation of existing hospitalization, a persistent or significant disability. Neurological deterioration is defined as a decrease of 2 or more points on the Glasgow Coma Scale, or an increase of 4 or more points on the NIH Stroke Scale that is not related to sedation or hypnotic use and is sustained for at least 8 hours.
Hi, Dr. Hussein. How are you?
Good afternoon, Kathleen.
Good.
How is the patient doing?
Oh, he's doing great. He got some rest, had a good night. He's been holding stable with the blood pressure. We've got him right at 7.5. That hasn't changed for a while now. And other than the one time I called you, and thank you so much for coming right in,
Yes.
he's been doing real well. Maybe a little more alert this morning.
Oh, excellent, excellent. Well, I guess we can, you see, now we're done with the first 24 hours, and this is kind of the intervention part of the study.
Oh, thank you so much for getting those orders in there too. We really appreciate it.
Yeah, absolutely. So from now on, this is more of an observational phase where we watch the patients clinically and say if they improve or deteriorate. Of course, intervene based on that, but the study intervention is done now.
Okay.
So I think he is doing fine. If we can stop the nicardipine infusion, he can be moved to the floor.
Okay, and you're going to look at oral medications now then? Because
Yes.
he's been at that stable place for a while.
Yes,
so, okay,
we're starting
great.
that.
Wonderful.
All right, well, thanks for the help.
Oh, thank you. It's been
Okay.
fun. Thank you.
Bye.